So I think most of you must be MD exam goings because DNB's exam is starting in I think the next 1 or 2 days. The exam is, I think. So that's why I think the relevant crowd for this is also going to be MD exam goings at this point of time. All right, so I'll just share my screen. What are the points that you have to keep in mind when you're writing the theory exam? I'll keep it very, very short, just like how you have to keep your answer. Don't try and stretch it unnecessarily, right? It's very easy to make out whether you know or you don't know by looking at the first few answers and by looking at the first few paragraphs. So that's where you have to focus on, how you write your first 4, 5 answers is going to determine how you're going to score on an average on all the questions, whether you know or you don't know. And the beginning part, don't try and start with introduction, talking about, something other than what has been asked. So be very, very to the point. You need, before you start writing your answer, in your head, you need to have figured out what are the things that you want to write. Create a structure for everything and make sure you highlight that structure. Even if you know it in your head and you don't express it, it's not going to be apparent, right? So you want to make it very clear that in your head you have, thought out of what are going to be the things. For example, whenever I make any sort of a class, I first need to have a framework that, okay, ek introduction hoega of very, very short 1 or 2 lines. Then you will be talking about imaging modalities in that condition. Then you'll be talking about the clinical approach and then individual pathologies. That holds true for any review-based question that you get. Okay. I'm just seeing if Mayuki, if you have joined, I think you've joined. I'll just start describing what I have, and then you can just add. I think you are here. Are you
Yes,
here?
ma'am, I'm here.
Okay, great. So I'll just show this slide and then we'll talk about theory first and then we'll talk about practicals. Okay? Yeah. Hi. So you can introduce yourself and then I'll show my PPT.
Okay. Hi, everybody. I'm Dr. Mayuki. I have just passed my DNB theory and practical, and all I used for my preparation was e-conceptual. So, unfortunately, I was introduced to e-conceptual a little bit late. So, I only started using it in my third year, but that was the only source that I used for my theory as well as practical. So, I would like to share
Amazing. So we don't want to promote the app at all. That is not it.
Yeah, I get it,
Mainly,
ma'am.
most of these students are, exam goings. So we want to, run through the exam. How did you focus on the theory papers, and then how did you focus on the practical? So as I was saying, have a structure. Don't beat around the bush a lot. Use a lot of flow charts and illustrations wherever you can, and that is more or less what I had to say. So what would be your advice as far as the theory exam goes, and what do you think that you did correctly?
Okay. So what I did correctly was I focused on the previous year questions. So I did all the papers. The notes were only in the PDF form by then, by when I was preparing, and I used I started year wise, and I started from say 7 years back, and I covered each and every question. So there was a question. I would read the theory. I would maybe read some article or radiopedia. I just skimmed through it
Yeah.
and
Yeah.
skimmed through it really quickly. But I went through all the papers and all the notes. I think thrice, and the day before my exam on one more time. So total 4 times I went through all the notes of the previous year questions. And in the theory exam, I think what I did right was I made a lot of diagrams. I took crayons with me, and so I just very rough line diagrams. I drew a lot of diagrams. So say, for example, there was a question on ankylosing spondylosis. So
Hmm.
and by that time I had very little time left. So all I drew was diagrams in my answer, and I think that fetched me some marks, so I passed. That was one thing. And then in just before I started writing, I marked all the pages. All the pages are already marked, say 1, 2, 3, 4, all for the questions. I drew
Hmm.
my margins, and I kept focus on the timer, that I cannot give more than this time, this particular amount of time to any one question. Otherwise, I will end up missing the paper. So even if you know a lot in one question, you have to attempt all the questions. Otherwise, it becomes difficult.
Yeah, that's very true. A lot of times we will write one answer very, very long, the one that we know, but we forget that all questions have equal weightage. So I think that's something which is very important. So suppose you have to guide any of your juniors now who are asking कि मैम bookmark कर दो, even now people ask कि क्या important topics है, या what are the things that is to be kept in mind. So what do you think, per system, what are the high impact areas that you just can't miss out on? So if you have to enumerate, one system after the other or paper wise, कि क्या है जो topic सबसे ज्यादा repeat होते हैं that you just cannot miss, what would that be जो आप final 1 month में पढ़ोगे?
Ma'am, this is just true. I took a printout of the sheet that you had given us. Important theory
Yeah, yeah,
papers,
yeah,
important theory topics. That is all I used. Even in the last day, last few hours of my preparation, I had a printout of
yeah,
that list, and I would check that okay, I've gone through this topic, I've gone through this topic, and you gave us that list, and that was sufficient for the night before also. And the night before, you have to at least just skim through all those topics.
yeah.
So that was very important. I think that was it for me the
Yeah,
night before.
that is something that I just compiled using the previous year questions of DNB. And while
Yes,
I
yes.
was making that list, I realized, that there was so much repetition. And even this year's exam, at least 3 or 4 out of every paper had been asked in the last 6 years. So whatever are there for DNB as well, I think for MD exams as well, that becomes relevant. Those are the important areas that you want to focus on. So there is a session which I have taken about what are the important theory topics, and I think
Yes.
most of them have been covered. So, if we have to talk about, so you talked about the preparation, 1 month prior, which was focusing on the previous year questions. Now, if we get to the practicals, was the preparation hand in hand with theory exam, or first you were preparing for theory, then practical? So, how to go about the practical exams?
Okay, so ma'am, in DNB we get a considerable amount of time after our theory exam for practical. So I started my practical prep only after that. So for
Hmm.
practical, I basically divided my study into OSCE, spotters,
Hmm.
and long case because short cases are covered with OSCE only. So for OSCE, I did all the DNB OSCE sessions, spotter sessions, and I attended CRISP also, and
Yeah.
a lot of things. For I just read the spotter book a lot of times. I completed that, and here and there also on Telegram there were a few
Yeah.
groups
Hmm.
which helped me with the OSCE. OSCE, one thing I realized later after my exam was key in OSCE also there is repetition. For example, there will always be a question about MRI artifact and the sensitivity, specificity. So a few questions are always from there.
Yeah.
So OSCE I did from there, and for the table viva, the video which you had given us, and for X-ray physics, I did Nikita ma'am's all the videos. The
Hmm.
physics videos,
Yeah.
everything was X-ray tube and everything Nikita ma'am had covered. I did everything from there.
Yeah.
And for the table viva, the TLD, the contrast, your video, I watched the videos also at least 3 or 4 times. This contrast and then in CRISP we had the session for the instruments by Dr. Monga. That
Hmm.
also really helped. So
Yeah.
it's just how I managed to do everything.
Right.
That's
So
all.
you're
That's
you're
all.
basically marking the CR app for the juniors, that these are the videos that you have to see
Yes, 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 ma'am.
from or table viva. So what all was there on your table viva, if you can recall? The
There are
usual
actually a
stuff?
lot of cases,
Yeah. Yeah.
a lot of spotter cases also. For
Hmm.
example, trichobizor, midgut volvulus, a few barium studies also. I don't recall exactly. Then
Yeah.
my long cases were CAGB and Ewing sarcoma.
Hmm.
So I had, ma'am, I had watched the bone tumor video at least twice or thrice, and because I was very weak and we did not get to report a
Yeah.
lot of those.
Yeah.
So
Yeah.
bone tumors, liver lesions, all these important topics that they
Hmm.
say that they're very important for the
Yeah.
long cases. I had watched the videos at least twice or thrice. Liver lesions, I think I watched 4 times.
Yeah, amazing.
So
So you basically utilize the app very well, and you had in
yes,
mind what are all the long cases which are to be
yes,
covered, and just
yes.
that approach in mind, So I think
Yeah.
that helps for theory as well as practical. So for at least
Yes.
for the MD exam goings, you prepare hand in hand, because you will not get a lot of time in between the two exams, right? So immediately after theory gets over, you'll have your practical. So it's a good idea to prepare for physics right now. I think it's a good idea to start with physics, because otherwise, you are not going to be able to do it very close to the exam. So start
Right.
with physics, because it'll take multiple revisions. I think it's very volatile. So, how did you approach the physics videos? One after the other you were watching, or was it, just based on the questions?
Ma'am, physics, X-ray physics in particular, and I watched all the videos, ma'am.
Hmm.
I didn't make notes of them,
Yeah.
but I just watched, and I watched them, I think, on 2x.
Yeah.
Just for 2 times, I watched the important videos, the electric effects, the tubes,
Yeah.
the grids. I did them all, ma'am, from the video only.
Right.
That
So
was sufficient for me.
yeah, that
So
was sufficient for the theory exam as well as the practical.
yes, yes, ma'am. And one video which I unfortunately missed was MR Artifact, which I would really recommend my juniors to watch. I had missed it, but it's also very important. And one OSCE always
Mm.
comes from MR Artifact.
Yeah.
And CT artifacts also, all of those things. I ultrasound, contrast, media, elastography, everything I'd done for the theory paper also, because these are previous year questions.
Yeah, and you get usually one recent once at least, and most of the times they revolve around either MR elasto or MR iron quantification or fat quantification. One of these usually comes up in the exam. So these are very important. If you guys have any doubts, why I'm doing this live is because if you have any other doubts that you want to ask Mayuki, I keep interacting with you, but to get some perspective from somebody who's used the app and is on the other side, I think that is something which is important. So that's why we're doing this exercise. So if you have any other doubts, that you want to ask her, please feel free to write it in the chat as well. So if we can go through your exam experience, if you can just go back in time and, tell us just immediately after you came out of your practicals, what was the whole experience like? Like, take us through what all is a part of the exam.
Okay, so the first thing that we do is OSCE. So we are made to sit in front of a giant screen, and all the 10 people giving your exam with you, they sit together. There's this huge screen, the timer starts, and you have one sheet for each question. So the
Yeah.
question flashes in front of you, and you have about 5 minutes to attempt the exam, and you have to write everything down. So even in OSCE, I figured that right, even if it is correct, wrong, whatever, you should never leave it unmarked. Just write something. So we
Yeah.
might as well fetch you 1 or 2 marks, even if not full marks, and that
Yeah.
counts in the end.
True.
So, but and that goes in a breeze. That was not the difficult part. Whatever comes to your mind, some if you cannot, if you're not sure of the diagnosis, just describe the lesion. Be careful about the sides.
Mm.
And one another important topic is skeletal dysplasia.
Mhm.
That also I think
Yeah.
always gets asked in
Yeah.
OSCE.
Yeah.
So then after OSCE, we're given the case sheets for the long case.
Mm.
Then you're divided in groups of two, and then you given the case sheet, case films. You were given 20 to 30 minutes to go through both the. I was given both the films at once, and then I was given 30 minutes to go through the cases. And then I had my wife was the first one in my batch. Then I was made to sit in between the two examiners with the film in front of me, and I was very nervous that day, ma'am. I was very nervous
Yeah.
because both of these they are senior examiners, and in DNB we don't get to interact with a very senior faculty.
Yes.
So I was kind of very nervous. I mixed the films also, which I don't recommend anybody doing. Of the two cases, I mixed the films also. But and I made a lot of blunders. For example, I started describing my MR films first before the CT. So I
Mm.
got a check that no, you always start with CT
Yeah.
and then you go to MR. But fortunately, I was able to sail through. CHGB we had reported also, so I was able to answer the follow-up questions,
Yeah.
and that was fine. That was fine.
So
The thing is that
they do give you benefit of doubt. I mean, was it as grilling as we preemptively think that it's going to be, they're going to be too rude? Was it like that, or how
no,
sweet were they?
they were about a 7 on
Even
a
out of
scale
10.
of 10.
Yeah. Okay. So
But
that's
still good.
good. I mean, so all of you have to remember that they're not there to fail you, that is not their intent. They will only fail you if you try really hard, you know. Otherwise, they are there to pass you only. वही intent है. Unlike popular belief, they don't want to keep you longer. So that is what is the thing. कि unless you make a solid blunder, they will fail. Otherwise, they want to pass you. So thank you so much, Mayuki, for always
Thank you,
being
ma'am.
so
My
ready
pleasure.
to join at such a short notice. So thank you so much, and I'm sure the students are gonna clear their exam. And thank you, and reach out to you later as well. All right, guys.
Thank you, ma'am.
Thank you so much, and all the very best for your exams.